hosting us. I know I was here once before, but it's been quite some time. I'm really happy that you're doing the work that you're doing, but also that you're participating in this, especially Dr. Thwani and Ms. Martin for being here to discuss the important work that we're doing to serve our community better, to serve the health of the country better by lowering prescription drug prices for families here and all across the country. And look, for me, this particular issue is personal. I'm a father of a daughter with type 1 diabetes, and so I know firsthand about the high cost of prescription drugs. We've experienced it over the years. And we know that while we've made some progress, there's a lot of work left to be done. For a long time, and we've heard this story over and over, Michiganders and people across the country have been forced to make a choice between getting the life-saving medication that they may need and paying the rent, paying the mortgage, putting a roof over their heads, paying heat and light, and getting groceries. People are struggling, and so we took this on. The idea that medications could be within physical reach but unaffordable was something that I found to be completely unacceptable, particularly at a time when those large pharmaceutical companies, big pharma, are bringing in record profits at a time when people really do need access to life-saving drugs. The Inflation Reduction Act that I worked with President Biden and Vice President Harris to put into law, Vice President Harris, in fact, cast the tie-breaking vote on that legislation, took on those special interests and has delivered some real serious results for mid-Michigan and U.S. families. Under this law, and this is interesting, for the first time ever, we're able to negotiate directly with pharmaceutical companies the price of prescription drugs and lower costs, particularly under Medicare for seniors. In August of this year, the Biden-Harris administration announced that they had completed the first round of negotiations and had dramatically slashed the price of 10 of the highest cost drugs in Medicare by as much as 79%, proving the point that we were able to reduce those prices if we could negotiate directly with the pharmaceutical companies. Seniors will save over $1.5 billion in out-of-pocket costs to treat conditions like cancer, like heart disease, blood clots. Not only does this law, the Inflation Reduction Act, empower Medicare to negotiate drug prices, but importantly, it limits seniors' out-of-pocket costs for drugs to $2,000 a year. So for those who are on diabetes, particularly on Medicare, it caps out-of-pocket insulin cost at $35 a month. I'm particularly proud of that because that's legislation that I personally authored. Last Congress, we made progress on making significant savings for seniors, but we know that we have a lot more work to do. Earlier this Congress, I should say, I reintroduced that legislation that was in part signed into law, the Affordable Insulin Now Act, to extend that $35 cap on insulin prices to all Americans, regardless of their insurer. I was proud to author the provision under the Inflation Reduction Act that capped, as I said, this for seniors. But that's just the start, and we have more work to do extending that benefit, particularly when you consider, and I know you deal with this on a regular basis, the actual cost of producing a vial of insulin versus what the over-the-counter cost can be is something that just should not be acceptable. We know that it costs a few dollars to produce that insulin. Insulin is an amazing therapy. It's been around for 100 years. We ought to be able to make sure that no American has to make a choice between insulin and food on the table. I've often thought about that person who's standing at the pharmacy counter needing their insulin, and they can see the vial of insulin across the counter. And even though it's physically within reach, it's financially out of reach. And to see people have to make the decision to either take their insulin or maybe cut down on what they're taking, you know the effect of that on the health of these patients. And it's just unconscionable. So I have asked my colleagues, I've written to all my Democratic and Republican colleagues asking to join with us. We have over 100 members of Congress that have signed on to our legislation to extend this benefit to everybody. And I'm hopeful that in the final weeks of this particular Congress, we might be able to have a shot to get this done. To talk a little bit about what the effect of all that is and the importance of this, we'll first hear from Dr. Kawani and then from Ms. Martin about their experiences and how they think this is important. So thank you, Doctor.
Good morning. Diabetes is a complex problem. Insulin is just one of the tools. These are the patients who have high blood pressure, high cholesterol, increased risk for stroke, heart attack, circulation problem, loss of limbs, kidney failure requiring dialysis, and so on and so forth. Control of blood sugar, very important. We have the tools, but if the patients are not able to get them, it becomes just too hard. And if they are able to get them sometimes, and then not at other times, it makes it even harder. Now, there are newer drugs coming in to able to help. Sometimes they are able to offset the use of insulin, but they cost even more than insulin. All of these GLP-1 analogs and SGLT2 drugs that are being written and advertised on TV, first month will be samples. After that, $300 a month, $600 a month. Patients will say, I cannot afford it. So I'm sure you know what has been done so far, Affordable Care Act, part of it, and what is being done has to go further. Otherwise, we have all this research, all this technology, and it is not being used or cannot be used because of the financial factor. What do the insurance companies do? They jack up their premiums. So just imagine a family, $2,000 a month is your premium. And once they start including GLP-1, next year it will be different. And the premiums going up by 10, 15, 20, 30% is not uncommon at all. Or they might say that we're not going to cover these drugs. Just imagine. So it is a complex problem, ongoing problem. Americans pay insulin prices 10 times more than what Europeans pay. Even Canadians pay. So there is something in the system that needs to be changed so as to be able to make it fair. And as Mr. Kelly pointed out, insulin was discovered over 100 years ago, and the Canadian doctors gave away the patent for $1.
That's right.
The patent was given to the company Eli Lilly for $1. Just imagine. And they have been milking this in a wrong way for a long period of time. And it is not just the drug companies, there's the system. And when you talk to the CEO of the drug companies, they will tell you that it is different. When we sell the same product, for example, Novo Nordisk, it sells the same product in France for $10. Here it comes for $100 at least. Same insulin vial. So there is something in the system that needs to change, but makes a patient care difficult. And the outcomes as a result are challenged. And as was pointed out, patients have to choose between actually taking care of themselves versus doing other things that they need to do for themselves as well as their families. So it's complex. We need help. Thank you.
Thank you, Doctor.
Wow. Insulin is a life-saving medication that our community residents need, and they deserve to have it. If they don't have it, it becomes a health disparity. We need to be able to work together and promote a system and put in place and make sure that this goes through and it stays so that they can get what they need to survive. I'm out there in the community almost every day, and it's so sad to hear patients be in fear when they have to go to the hospital because they don't want to go, because they don't want one more medication added, because they don't know how they're going to pay. I know a lot of times we think that a lot of the marginalized communities are non-compliant, but it's not that they're non-compliant. They just don't have access. And to be denied access because of financial costs is not right. I ask that everybody just imagine when you get up in the morning, what do? You get up in the morning and you don't think about needing that medication to live. You don't think about not having the finances or the resources. that you need to be able to survive. It is imperative. Capping insulin prices, it helps prevent the financial hardships. As they said, to be able to choose whether I'm gonna get my insulin or eat, it's just inhumane. Capping insulin prices also help promote better access for health equity by ensuring that cost does not become a barrier for this essential medication. It also helps prevent hospitalization. If patients can get treated with the resources that they need, then the hospitals are not backed up. And then they're not, going into other medical conditions. So capping insulin prices is much needed for the use of our community.
Thank you very much. And I think that last point should be underscored. I'm glad you made it, that, I operate on the principle that there's a moral imperative involved. When there is a life-saving drug available that is inexpensive to produce, people shouldn't be priced out of access to that particular therapy, insulin being the best example. But even if one does want to consider the moral aspect of this, or even the health aspects of this, the economic effect of making sure that people who need insulin or other therapies that are available but unaffordable, the effect of that access is to reduce overall healthcare costs in this country, to produce better outcomes. But the better outcomes produce lower healthcare costs, fewer hospitalizations, fewer complications. I mean, as a father of a now 32-year-old type 1 diabetic who was diagnosed when she was 9, my wife and I have worried this entire period, not just about managing her diabetes now, but about making sure that we're doing everything we can to avoid those later in life complications. If she didn't have us, until the Affordable Care Act was passed, there certainly would have been times when we would have had to make the choice about whether to provide the insulin or take care of the other bills that are staring at us all. And we're in a different position as a family. I acknowledge that, but many families right here in our community don't have that option, and that's why I think this is important. Now, the purpose of our conversation today is twofold. One, to mark the fact that we have the $35 out-of-pocket cap for seniors. To make the case that cap ought to apply to everybody is one of the messages. But then importantly, to point out that we have finally now begun the process of negotiating drug prices. The first 10 drugs that have been negotiated under this legislation, those pricings will go into effect 1 year from January of 2026. But we'll start the process of negotiating on the next 15 drugs right away, and each year after that, to the point where the 100 most expensive drugs that are available in the marketplace right now will have a price that's based on a negotiation between the biggest purchaser of these pharmaceuticals and the producers. In any other part of the economy, price is determined by an agreement between the buyer and the seller. For the first time ever, that's going to apply to life-saving drugs, and it's something that I think we need to accelerate. Thank you both for your comments, and certainly open it up to any questions on topic, and if you have an off-topic question, we can deal with that afterward.
Doctor, I want to direct one at you specifically. You mentioned towards the end of your comments about having folks on insulin and the struggle that it provides to you. Can you elaborate on the fact that you may be standing in a room with somebody and telling them that they now have to have insulin, or they have to have some other drug, some life-saving drug to continue, knowing full well that these folks can't afford it? How does that affect your daily discourse?
What happens is we have been in this line of work for over 30 years, so I have a lot of tools available, a lot of ways of approaching it. Now, if I know somebody who cannot afford it, I don't offer them expensive drugs. Now, I'm not trying to advertise for Walmart pharmacy, but they have less expensive options, and which is $25 a vial. So they have to be taught use syringes and vials, and then they're expensive drugs, and so these drugs are available without a prescription. So you can, if you are knowing what to do, you can even avoid the doctor's visit. So there are ways around it. There are slow-acting insulin available, there are intermediate-acting, there are mixed insulins available in the form of a vial.
So it's really kind of changed how you give care to people because you're helping advise them as well into the best needs for them.
Yes.
That's all I got. Dale, anything?
No, they've got pretty much
All
the
right.
questions I've
No, I'm
from
all
that,
set. Thank
so,
you so much.
yeah.
Thank you all very much. Thanks, Doctor.
Thank
I
you.
really appreciate you doing this.
Yeah.
Thank you. Keep up the